Hi, this is Andrea Kane, and we are on the Language of Medicine 12th edition by Davie Ellen Chabner for HSC 114 Medical Terminology. This is week 6, and we are on chapter 14, which is the lymphatic and immune system. And if you look at your syllabus, this is unit 10. So if you're looking for competencies, that's where you'll find them, is in your syllabus under unit 10 for this one, and chapter 14 in your book. Our goals are the same as always. We are looking at the structures and the terms, the terminology, combining forms, word parts, pathologic conditions, lab tests, procedures, abbreviations, and all sorts of other fun things. So let's talk about lymph. What is lymph? It is the clear watery fluid that surrounds your body cells and flows in a system of lymph vessels throughout the body. I'm sure you've heard of lymph nodes, and we'll be talking about things like that. Lymph fluid originates in blood. It is rich in those lymphocytes and monocytes. It flows through lymph capillaries and vessels, lymph nodes, lymphatic organs. Your lymphatic organs, and you need to make sure you know this, are your liver, spleen, thymus, and lymph nodes. So again, you need to make sure that that's something you study up. And lymph absorbs lipids in the intestine as well. So what is it that your lymphatic system does? It transports proteins and fluids that have leaked back to the bloodstream. So in other words, it's sort of a catch-all. So have you ever seen gutters on a house? They capture the rain and they take it away from the house so it doesn't cause leaking in the basement. Well, the lymph system is sort of like that. It captures the proteins and fluids that need to go back into the bloodstream. And so they capture those and they direct them away from where they shouldn't be to where they should be and where they can do the best good, or at least be handled properly. So if you think of that, it might help. Your lymphatic vessels absorb lipids from the intestines and then transport those to the bloodstream. And lipids are fats, so it's different than nutrients. Let's put it that way. Lymphocytes and monocytes protect the body by mounting a cellular attack on foreign cells and organisms. That's your immune system. That's why lymph and immune are used together. They're not interchangeable, but that's handling the immune system is a big part of what the lymphatic system does. So what is interstitial fluid and lymph capillaries? Sorry, I'll spit it out eventually. What are those structures and how do they work? You have blood capillaries and lymph capillaries. You have a lymph vessel, interstitial fluid, and tissue cells. And yes, thankfully, we have a good visual here that we can take a look at that kind of explains all of that. All right, so we have this lymph vessel, and it's green. And we have the blood capillaries. And as you can see, the blood from the arteries starts at the bottom on the right. Blood from the arteries, it flows through the reddish part. It goes in, does its exchange, goes back through blood capillaries to the veins and heart. That's the top of the right-hand side. In between and intermixed in is this lymph vessel with interstitial fluid where the tissue cells are. And the lymph capillaries are capturing what is in the wrong place at the wrong time, as well as handling those lipids and working on the immune system. So lymph fluid originates from the blood, filters out of the tiny blood capillaries into the spaces between the cells. And so you can see how that is going to be, how that goes into these vessels that are thin-walled called lymph capillaries. And it's going to get into the larger vessels, and that goes through clusters of lymph tissue finally reaching the large lymphatic vessels in the upper chest. And then when they're in those large lymphatic vessels, they empty into the bloodstream. Is that as clear as mud? Sorry. Maybe this will help. So you've got your heart again, and you've got your arteries that are taking the oxygenated blood out to the body. You then have what's going on in those tissue cells and the blood capillaries and the lymph capillaries. You have then the exchanges that take place there. The blood heads back through essentially venules and veins with the waste materials. And the lymph system picks up the rest of that and drops it into the veins as well. Hopefully that makes sense. So parts of the anatomy, the lymph anatomy that we're going to talk about, lymph capillaries, like lymph vessels, lymph nodes. You have major sets of lymph nodes in these areas. You have cervical lymph nodes around your neck. If you've ever had a sore throat and they're trying to see if you have swollen lymph nodes in your neck, the doctor may have put his hands on your neck or her hands on your neck and just felt to see if you have swollen lymph glands, if they are enlarged. Axillary lymph nodes are in your armpits. And for those of us who are female, we have a tendency that if we have breast cancer, it metastasizes first to those axillary lymph nodes. So if someone is suspected to have breast cancer, or if they've confirmed it, they're going to want to take a biopsy of those axillary lymph nodes, because that's one of the very first places breast cancer spreads to. And not that men can't have breast cancer, because they do. Men, though, it's a much rarer type of cancer for a man. But for women, that tends to be a much higher rate of what happens. You have mediastinal or chest lymph nodes. You have mesenteric intestinal lymph nodes. You have para-aortic lymph nodes, and you have inguinal, around your groin area, lymph nodes. And any of those can get invaded by cancer. So, and then we will also probably in this chapter talk about the types of cancer that arise in these types of lymph nodes. So what types of cells are we talking about in those lymph nodes? Macrophages, B lymphocytes, and T lymphocytes. You may have heard of B cells and T cells. This is a really good slide. If I were you, I would make these into flashcards, because these three are pieces of information you will need. Hint, hint. Spleen. What does your spleen do? Has anybody ever heard of a spleen? It's not something that we talk about a whole lot, but you have one unless it's been removed. And sometimes people have been in accidents or had some kind of trauma that causes so much damage to the spleen that they have to remove it. And people can live without a spleen, but when you see all that a spleen does, you understand why they're considered immunocompromised, or at least having a very sensitive immune system, because your spleen does a lot of things. So I'll leave you to read that. Your thymus gland. We don't often talk about your thymus gland. Where is it? What does it do? You know, it's not one of the most exciting parts of the body by any means. However, it really does some pretty important things when you read this slide and you look at that. So make sure that you know where the thymus gland is and what does it do. What does it do? So we talked a little bit about the immune system. We talked about there are leukocytes. Again, back to the last chapter of the blood system. What are leukocytes? Um, Neutrophils, monocytes, and macrophages. So those are part of your immune system. They play a role. You have lymphoid organs. Your lymph nodes, spleen, thymus gland, tonsils, and adenoids. Where did we talk about tonsils and adenoids? That was way back in the digestive chapter, remember? Those produce lymphocytes and antibodies. And so those are all part of your immune system. Your immune system is not only your lymph system, it's a little bit of blood and lymph, and that's why these chapters are together in week 6. Your immunity is your body's ability to resist foreign organisms and toxins that damage tissues and organs, and your immunity can be natural or it can be adaptive. Natural immunity is just for whatever reason you can fight it off. Adaptive is maybe you've been exposed to it in the past and your body has developed the immunity. So if you run into it again, it doesn't affect you. A good example might be measles. If you had measles as a child, the odds of you getting measles again as an adult is much less because you have it, you develop those antibodies against it. That's an example of adaptive immunity. Oh, I guess I could have gone on to the next slide. My apologies there. So your natural immunity is something that's present at birth. It's not dependent on prior exposure to an antigen. And then your adaptive immunity, we talked about that you've had some kind of exposure or you've been vaccinated or you've got something that has caused your body to develop this immunity. It wasn't something that you had from the beginning. So what are B cells responsible for? And again, hint, hint, B cells and T cells. Make sure that you are very familiar with both and what they do. And it's not that you need to know the CD8 plus T cells or that type of detail. You just need to know that your T cells can attach and kill antigens. They can secrete cytokines that help respond to antigens. They can promote the synthesis by B cells and other T cells, and that they also can help them from attacking the body's own good cells. And then another part of your immunity is your dendritic cells. Your book should really go into a lot of detail on this. Make sure you understand about vaccines, what they do. And I think it's important to understand about the transfer of immune cells. I talked a little bit about bone marrow transplantation, just so that you're familiar with that. And now we're on to vocabulary. Plenty of vocabulary for this chapter. And we will have more because I think there's something like 70 or 80 slides in this one. And let's see. Still more. As you can see going through this chapter, your lymph system is very important to your body. I mean, it's just amazing. It naturally complements your blood system, but it goes a bit further when you talk about the immune part of its function. And I know there is a lot of debate and has been for maybe the past 30 years about vaccinations. Um, and you're free to research on that and make up your own mind on that. Would just encourage you that if you are hesitant about vaccinations, that you look at large studies where they've looked at different vaccinations over many years and um, to see really what is the impact of vaccinations. All right, a quick quiz. Which lymphocyte originates in the bone marrow and transforms into a plasma cell to secrete antibodies, sorry, not antibiotics, but antibodies. This is the kind of thing you're going to need to know for your test. So if you're struggling on this, make sure you go back and you study those. Formation of antibodies in lymphocytes after exposure to an antigen is, think. Now we're back to our combining forms. That combining root plus a combining vowel equals a combining form. Notice the difference between lymph and lymph node. That's a tough one there. Make sure that you're aware of that. A couple of prefixes. And now we're on to disorders. What are some immunodeficiency or disorders that we run across with the immune system? One that is very well known is AIDS, acquired immunodeficiency syndrome. This is another disease that has had a lot of stigma attached to it. And it's just really unfortunate that um, it has, because it really prevents people sometimes from getting the testing and help that they need at the beginning when they're finding out whether or not they're HIV positive. So we really need to reach out and encourage people to get tested. Just because you find out you're HIV positive does not mean it will develop into full-blown AIDS. And there's been so much research and development in this area that regardless of how the HIV status positivity occurred, there's just so many treatments to really help those who have this live long and productive lives. So AIDS is a big disease that attacks the immune system. And yes, it can be deadly, and it has been in the past, but so much has been done to really, truly help patients who are HIV positive not end up with AIDS, or if they do, managing it to live good lives. So, what are the, and this is where AIDS gets ugly, shall we say, because with AIDS, it attacks your immunodeficiency system. It attacks your immune system. And when it does, it allows all these other infections to come on in and have some fun. And that is not good. It's essentially like taking a well-guarded place and removing its defenses and inviting in all these opportunistic, shall we say, infections that can really cause trouble to the body. And that's what makes AIDS so destructive. It isn't necessarily having AIDS, it's the fact that AIDS destroys all the protective barriers that keep these things out or keep them minimal or keep them minor. So, as I talked about, there's been a lot that they have done with developing drugs to treat AIDS. And these are listed in here. Hypersensitivity, aka allergies. Anybody have allergies? um, when I was a kid, my allergies were to hay, and if I were in barns around hay, which I was on a fairly routine basis, I had to take allergy medicine on a daily basis. Otherwise, I had that awful hay fever, allergic rhinitis, that I had to deal with. And you can go on and see some of these other allergies and whatnot. There are tumors. People can have tumors in the lymph system. If you've ever heard of lymphoma, that is a malignant tumor of the lymph nodes, lymph tissue. There's Hodgkin's and non-Hodgkin's lymphoma that you may have heard of. Multiple myeloma is that evil tumor of bone marrow cells, and then thymoma is a tumor of the thymus gland. And often people with myasthenia gravis find themselves with that. And it can be implicated in lupus, if you've ever heard of somebody with lupus, or rheumatoid arthritis. So you're going to want to just be aware of these. This is a really good slide to talk about the staging of Hodgkin lymphoma. And it gives you a good example. You can see how stage 1 it's a single lymph node or group of nodes. It's contained. It's not throughout the body. Stage 2 is now you've got 2 or more sites on the same side of the diaphragm. Stage 3 is now you've got disease that's on above the diaphragm, below the diaphragm, and you may have spleen or some kind of extranodal disease going on. Stage 4 is you've got extensive involvement, and now it's picked up liver, bone marrow, lung, skin, those kinds of things. So it just shows you how, as it spreads, where it spreads. What is a malignant condition associated with AIDS? This one is something that you would have probably heard about if you had studied AIDS. If you hadn't, go back and look. But again, thinking malignant condition, this should help you. So what types of lab tests are performed when you think about the lymph system or the immune system? And this just lists those for you. There are CT scans that are often done to look at the lymphoid organs, lymph nodes, spleen, thymus gland. And now we get to good old abbreviations, and there's a lot here. And we get to some more combining forms. And some suffixes. And some prefixes. Watch out for ana and retro. Even though they both have backward in the meaning, they're very different, so watch out for that. What is the name of the fluid that lies between cells throughout the body? We talked about this earlier. That was one of the first things we talked about. Malignant tumor of the lymph nodes and spleen marked by the presence of Reed-Sternberg cells in lymph nodes. If you're not sure what this is, go back and take a look. All right, that's it for this one. I will be back and we will talk about the endocrine system next, and that will finish up week 6, so hang in there.